Hi, I'm Dr. Alexis Colvin. I'm Chief Medical Officer here at the US Open and also Professor of Orthopedic Surgery at Mount Sinai. And I'm so excited to be joined today by Dr. Christopher Reverte, who is an emergency room physician, Mount Sinai West and Mount Sinai Morningside. Chris, thanks so much for joining our team this year.
Thank you so much for having me. It's a real honor and pleasure to be here. I've been 8 years at Mount Sinai Morningside and Mount Sinai West as a full-time emergency physician, working with a lot of great physicians, nurses. We have excellent residents. And as my first year here, I'm so excited to be here. It's a great operation that you have here.
So Chris, let's talk through some scenarios here. Let's say you're out on the tennis court and you start to develop chest pain. How do you know if this is something you should go to the emergency room for?
Yeah, in general, we do recommend if you're having chest pain for the first time that you always get that evaluated right away. Chest pain can be an indication that something serious is going on. Not always, but it's hard to say that without being evaluated by medical personnel and the doctor. So if you're exercising or playing tennis and you suddenly are having chest pain, it's a good idea to stop and go get checked out in an emergency room to see a doctor to make sure it's not a serious cause.
What about if you start to develop trouble breathing or shortness of breath? Is that something, are there certain reasons why you should go to the emergency room for that?
Yeah, sometimes things that would cause chest pain and shortness of breath might be linked together, and sometimes there's different things that might cause one or the other. But shortness of breath is another concerning symptom that we would want to know why you have it. There's many serious things that can cause shortness of breath and things that are not so serious, but without being evaluated and getting proper testing and physical examinations, it's hard to tell the difference. So if someone's having shortness of breath while exercising or playing tennis, it's also another cause for concern, and that person should go to an emergency room or a physician and get evaluated.
Then I think headaches can sometimes happen during activity. Is there something with feeling a headache where you would recommend that someone goes to an emergency room to get it evaluated?
Sure. Headaches, there's different types of headaches, and some are serious and some are not. In general, a headache that's severe and sudden at onset, that's something to be more concerned for. A headache that's what we call the worst headache of life, that would be a concerning symptom. And someone that doesn't generally get headaches and suddenly gets a headache while playing, that would also be pretty concerning. Also, if you have any features like vision changes, weakness, numbness, or tingling in your arms or legs, anything like that, that would certainly be concerning. And if anybody's on blood thinners for any reason, that would be another cause for concern when you develop headaches. So if someone gets headaches regularly while playing and they've been evaluated for that, and they have another one and it seems similar to previous, then you may not necessarily have to go to an emergency room, but new sudden severe headaches with any other neurologic complaints, that should definitely be seen emergently by a doctor.
So Dr. Reverte, any final thoughts on not delaying your care?
Yeah, absolutely. I would say if there's any doubt, play it safe. There's no reason to risk your health and safety in your life. So if there's any symptoms you're having that could be serious, such as chest pain, shortness of breath, headaches, amongst many other things, go ahead and get that checked out right away. There's no reason to wait. There's a lot of treatments that we can offer for all these serious conditions that you might have. And if you're worried about anything, go get that checked out. Don't delay it.